Welcome to the Loupe podcast. This is your go-to site for all things plastic surgery. Our goal is to bring you hot topics in plastic surgery, focused on education from residency and even throughout your practice. This podcast is not meant to be medical advice. If you have questions regarding your personal experience in plastic surgery, please consult with your personal physician. Now, let's get started with this week's episode. Hello, everyone, and welcome to our education series. I'm Dr. Morgan Martin. This episode is going to be a little bit different today. So I'm here with Greta Davis out of UC San Diego and Dr. Libby Van Gerwen. Hi, ladies.
Hello.
Hey. So as everyone knows, October is Breast Cancer Awareness Month. So for years, I've actually been thinking about how can we as trainees in surgery and specifically plastic surgery, how can we celebrate this month, but also help women not only understand their risk, but what are the treatment options and what are the options for reconstruction?
Sure, and I think one barrier to care is the unknown, and a lot of women fear what may happen if they are diagnosed. So in some instances, women may not even want to know.
Yeah, so today we have a special treat for everyone listening. I have asked Libby here, my friend and former classmate, to join us today for a conversation about breast cancer from a patient perspective.
So I want to start by sharing a few statistics today. The American Cancer Society's estimates for breast cancer in the United States for 2020 are about 276,480 new cases of invasive breast cancer will be diagnosed in women this year. About 48,530 new cases of carcinoma in situ, or CIS, will be diagnosed. CIS is non-invasive and it's the earliest form of breast cancer. About 42,170 women will die from breast cancer this year.
That's just incredible to think that that many women go through this every year. So overall, women actually have a risk of 1 in 8. That's an average risk over their lifetime of developing breast cancer. And so the current screening guidelines from the American Cancer Society are, so women over the age of 45, it is highly recommended to start yearly exams if you are at average risk. So this is different if you maybe have a family history or a known mutation. Women between the ages of 40 and 45, it is also suggested that you start considering undergoing your annual mammogram. After the age of 70, so women in good health should also continue with a yearly mammogram. And these recommendations actually come from balancing the risk and benefit of early screening of average risk females. So Libby, why don't you start by telling everyone a little bit about yourself and where you're from and your education?
Sure. So I'm Libby Van Gerwen, as these ladies said. I'm from Birmingham, Alabama, and I grew up here. I went to undergrad at UAB, where I did a Spanish degree and a biology degree. And then I went to medical school at UAB with Morgan. We were in the same class. And once I finished, I did a master's of public health while I was there as well. And then I went away to Tulane in New Orleans for internal medicine residency and chief residency, where I was also with Morgan. And while I was in New Orleans, I fell in love with infectious diseases because we saw all kinds of incredible tropical medicine and lots of really interesting HIV pathology. And the patients in New Orleans are just outrageously grateful and beautiful and vibrant people. So, a lot of the things that I learned in New Orleans really carried over into my career into infectious diseases. But decided to come back to Birmingham for my fellowship training because I'm from here. And also because the infectious diseases training program here is really, really strong. So just graduated in July of 2020, which was really exciting. So I'm about to start as faculty at UAB in November. So right now I'm doing a lot of research. I don't know. I guess I really wasn't into research when I was early in my training, but when I came to UAB, I started doing a lot of work that is more public health research related with LGBTQ populations, largely focused on STI prevention, HIV prevention, and in particular, I'm really interested in learning how to better take care of our transgender patients that have a lot of different sexual health needs that are really overlooked. So that's me in a nutshell. I also have a 4-year-old son and a new puppy. and a
Wow.
great husband.
That is a
He's there
lot to
too.
take on. That
Yeah,
is
just a few things going on over here.
yeah, that's incredible. So that being said, you had this very busy life, and then all of a sudden you were diagnosed with breast cancer. So tell me about that. You're so young. Did you have a family history, or how did this come up?
So it was a big surprise because I have no family history at all.
Okay.
And I've been a very healthy person, and I'm actually one of those weird infectious disease doctors who doesn't freak out about like, germs and getting sick and all those things. So I mean, I go to the doctor, but I'm not super in touch with, if something's wrong, I don't freak out about it. And one day, I guess at the end of my first year of fellowship, and so June of 2019, I was just sitting on the couch and I don't ever check my breast, but I just
Mhm.
randomly felt a lump and I had this sinking feeling in my stomach. I just knew something was wrong. And my husband, who knows me like extremely well, obviously, I've known him for 15 years, he was like, "What is wrong with you? Something is seriously going on." And so we had just moved back to Birmingham about a year before, but I had started seeing one of Morgan and I's med school classmates, Emily Mills,
Yeah,
as
yeah.
my OBGYN. So
Oh my
I gave her a call and I said, I've got this lump and I'm really nervous about it. Can you see me tomorrow? Um,
wow.
so she fit me in and I saw her and she felt it and said, based on your story, based on your age, I was 32 at the time. She was like, I'm not really too concerned, but because I just want to make sure we're going to get some imaging. So I got an ultrasound, which didn't look quite right. I got a mammogram, didn't look quite right. Everyone still kept telling me, "You're so young. You don't have the right story, the right history for this, but we're going to be safe." So I went and got a biopsy the same day. All of
Wow.
it happened in the same day, which I feel very fortunate for. And then I just kind of forgot about it for the week because I was reassured every step along the way. I am not the statistic. Like, this is not
Sure.
supposed to happen to you. Um, and I vividly remember the moment that I was told what I had. I was sitting at my desk in the fellowship office at UAB, which all of the infectious diseases fellows sit in this little pit, which of course we don't
Okay.
anymore because of COVID. But we all
Right.
sit together, and Emily called me and was like, "Hey, so your biopsy was positive." And I was like, "Positive for what? Fibroadenoma?" And so she told me what was going on, and I just broke into tears with all my co-fellows around me.
Oh my
So it
gosh.
was really hard, and I, I went up to the hospital that day and met with her and the surgeon, and we got started.
Wow, that is crazy. I did not know that Emily was involved. So
Oh yeah,
I'm sure that was hard for both of you, especially being
yeah,
friends and having to give that news and receive that news. That's crazy.
yeah. It was tough, but it was also
Mm.
kind of nice to have someone that
Sure.
give you that tough news. But I can't. I mean, she and I talk about it a lot now because we're still like great friends, of course. And
Yeah.
I'm so grateful for her, but I can't
Mm.
imagine giving that news to a friend.
Wow. So how long did it take from the time that you got your biopsy? How long did it take for that to come back?
It took about a week. I think I got the biopsy on a Tuesday, and she called me on a Tuesday.
Okay.
So it took about a week. And like I said, I just kind of acted like, I thought it was so unlikely that I had anything serious. So I really didn't think much of it. And then until she called me, I didn't really have very many emotions about it. And then, of course, the
Okay.
floodgates opened.
Right. Oh my gosh, that's crazy.
Yeah.
So what was it like, after you got that diagnosis and she was telling you, I know a lot of patients will tell me that, they don't remember anything from that day other than, the actual diagnosis. So did you have to go back and say, what did we talk about? Or what was that like for you?
So it was interesting because I'm usually a pretty cool and like calm, collected person, but I was a mess. From when she called me, I thought I was gonna have a wreck driving down the road to the hospital, which is about 15 minutes down like a really busy highway. It was at Grandview, which is down 280. And then I got to the doctor's office, and I had to call my mom and call my husband and call my sister and my mentor. And really after I told all of them, like the key people, and I sat down in the waiting room, I was able to kind of collect myself. And so I
Mhm.
got in the doctor's office with my surgeon and my OBGYN, and they began to tell me, the receptor status of the tumor, the HER2 status, and that's really all they knew at that point.
Mhm.
And I heard what they were saying, and they told me, this is what we typically do. This is the chemo regimen. This is how long it'll take. This is the time frame from chemo to surgery.
Mhm.
And this is all like within an hour of me finding out.
Right.
Um, and I feel like, they know that I'm a physician and they know that I'm able to understand these things. So to a
Right.
degree, they were talking to me at a level that they wouldn't be talking to a
Like
non-medical
information
patient.
overload probably.
And so even for me, I was like, how do patients hear this? Because I
Right.
had a hard time. I mean, I was like in a pretty good state of mind at that point, but I was still like, it's what now? Like, what's an estrogen receptor? I can't even like remember what this is right now.
Right.
But
Right.
it just took a little repetition, and the main questions I needed to ask were, when do we get started? What imaging do I need? I asked about fertility. I asked about, I knew a lot of the things to ask about. So I think that's a little bit of a different experience than a lot of patients have.
Right. Yeah.
Yeah.
So that being said, since you feel like you did know those things, could you tell us what you think were the most important that a patient should ask when they first get their diagnosis?
Sure. Yeah, I think it's important if someone doesn't really know the ins and outs of the, way that they stage breast cancer, which
Mhm.
honestly I'm an internist, so I like
Right.
knew what these things were, but I had forgotten them since studying for my boards, and so I needed a refresher on how breast cancer is staged, because that was a question that I got from a lot of people in my life, like, what stage is it? Is it aggressive? That's a thing that a lot of people ask. And with breast cancer, it's kind of complicated, right? So I had ERPR negative, HER2 positive, stage 2A. And so that's
Okay.
technically an aggressive tumor, but it's also an extremely treatable tumor. And the side effect profile for the chemo that you get is very different than, say, if you had ERPR positive. So I feel like the degree of severity is a really complicated question to answer. So having your doctor put that in terms that you can process is probably an important thing to ask.
Yeah, it's so funny that you say that because, it is so complicated. I mean, it's complicated for us as, I did general surgery, so that was on my boards.
Right.
And it's
Yeah.
definitely complicated and takes a lot of, effort to memorize all of that. Um,
Yeah. I mean, on the front end, I was really scared because I mean, obviously, but I was like, oh my gosh, I wish it was ERPR positive. I wish I had all the things positive. But
right.
now looking back on it, and we can talk about this in more detail if you like, but having a HER2 positive tumor was the best thing that I could have had. I mean, I felt that thing go away after one treatment of chemo.
Wow.
And I had a very, very good response. And then basically at this point, I no longer need any kind of chemo. Whereas if it were ERPR positive, I would need tamoxifen or
Right.
something like that for years. So it's not as straightforward as some other cancers as far as, is it the best kind to have? So,
Right, right, exactly. So it sounds like you had neoadjuvant and then you had your surgery.
yep.
What was the timeline like from when you got your diagnosis to when you started undergoing chemo?
So I got diagnosed and I had my port placed the next week, which was right before, I think it was right, no, it was right after I met with my oncologist. Back
Mhm.
to your question about what you should ask your surgeons or whoever diagnoses you, um, finding the right oncologist is just such an important thing. You know, the two people that I've spent the most time with through all of this are my oncologist and my plastic surgeon. So finding the right people in those two fields, I think, is really important. So getting a lot of recommendations from your initial diagnosis, I think, is extremely beneficial. And, you know, it's one of those situations where you want to get multiple opinions. Like you don't want to just, try to
Yeah.
be nice and go with whoever they recommend because
Right.
So yeah, I got recommended to my incredible oncologist, and he got my port scheduled for the next week, and I got it placed,
Mhm.
which was not that big of a deal. And then I wanted to go to, I had this international conference I wanted to go to. So I was like, I had a poster and I was like, I gotta go to Vancouver and
Oh my gosh.
go to the STD meeting. So I was like, can we start my chemo after that meeting? So it was about 3 weeks after I was diagnosed, which honestly I was kind of nervous about. I wanted to make sure that was the right thing to do and that was the safe thing to do.
Okay.
Um, and after talking to everybody on my team, they were like, it's not going to hurt anything to wait that much time.
Mhm.
So between starting and being diagnosed, I had my port placed. I had all my staging imaging done. I met my oncologist, and that was really it. I tried to forget that I had cancer for a little while.
Yeah, I'm sure that's really hard to do.
I dyed my hair pink for a little while.
That is so funny. I remember seeing that and thinking, wow, way to make, such a hard situation really fun, if you can call it that. But
Yeah. I mean,
um,
only an ID doctor could go to like a conference with pink hair. So I figured I would just take that occupational blessing and use it.
sure. Oh my gosh, that's crazy.
Mhm.
Tell me about, do you remember what size your tumor was on your imaging or your
Oh my
ultrasound?
goodness. So I think it was 2 centimeters. I can't remember exactly. Is that right? Centimeter. It was like
Yeah.
borderline. The size made it borderline stage 2. And
Okay.
then I didn't have any, so when they didn't like see any lymph nodes when they did my initial
That was my next
imaging.
question. Right.
Yeah, and they didn't feel any on exam. So they did a
Okay.
breast MRI. And when they did the breast MRI, they saw
Okay.
some lymph nodes that they couldn't tell if they were true or not true. And so I had to get a PET scan at the onset, actually. Um, and that's how they staged me.
Okay.
I had one lymph node in my right axilla that lit up on
Okay.
the PET scan.
Okay. And was there a discussion ever about, should we do surgery first or surgery later? A lot of times it's dictated by your stage and the size of your tumor, but was that a discussion with your doctor?
That was actually one of the first questions that I had.
Okay.
And because I was like, what do we do first? And
Right.
based on my staging and my HER2 status and my receptor status, everyone felt that it was best to do neoadjuvant because the data
Mhm.
is best in that, is my understanding. Y'all know more than I do about that.
Yeah, especially, if it was 2 or greater centimeters.
Yeah, it was right at 2, so that's why we made that decision.
Okay. So moving on to a couple more questions. So when did you see your plastic surgeon?
So I met with a breast surgeon first. So
Okay.
I did my cancer care at Grandview, which is a community hospital in town, and I liked their cancer center, so I stayed there for my chemo. But I knew I wanted to go to UAB, our big tertiary care center, for my breast surgeries. And I went to see one of the surgeons at the interdisciplinary breast clinic there that was recommended to me, the surgical oncologist, and she was like, with what you're going to have done, you need to see this plastic surgeon, Dr. Fix. He's the best one for you for your, you know, current situation. So I met Contreras first, and then I met Fix like very shortly after. I think my surgical consultation was maybe a month after I finished chemo. So I had chemo between June and October. I finished on October 31st. So
Mhm.
6 cycles every 3 weeks, and then about a month later, I saw my surgeons.
Okay.
Mhm.
And when you met with your plastic surgeon, so what was the discussion about all the different types of, all the options for reconstruction? Were you given multiple options and what was that discussion like?
Yeah, so one of the things that I really appreciated about Dr. Fix is that he spent so much time with me, which as an internal medicine person, no offense, surgeons, I was just flabbergasted and impressed, and I loved it. he spent about an hour with me talking about the different options. So he talked to me about the different, basically flap versus implants, and then a combination of the two. And he looked at all my pictures and my imaging
Mm-hmm.
and kind of my body habitus, and he said, the thing that would probably make the most sense for you since you're so young is to have something that will last you a long time and give you a really natural result.
Yeah.
The trade-off there is that you're going to have a longer recovery period,
Right.
possibly, and you're going to have a two-stage procedure since I had to have radiation.
Okay.
So what we ended up deciding to do was a mastectomy. I had to have a radical on the right because that one lymph node lit up, so I had to have all of my lymph nodes out, which were all negative, thank goodness.
Well, that's
Yeah,
great.
it was great. So they did a bilateral mastectomy. That was one discussion we had, bilateral versus unilateral.
Mm-hmm.
Um,
Okay.
and I decided that I wanted to have bilateral because of cosmetic concerns as well as, mental well being. Because,
Sure. Right.
being so young, I didn't want to have to worry about having any more breast tissue issues. So we did a bilateral mastectomy with the radical lymph node dissection, and then expanders were placed at that
Okay.
time. And I had radiation, and then I decided to do the deep flap reconstruction.
Okay. Did you have to make up your mind about the deep flaps early on, or was it like we'll place the expanders, we'll see how you feel later?
So he gave me some time to kind of think about it. I knew that was what I wanted to do because I didn't really mind having the belly fat taken and put somewhere else.
Yeah, that's a nice plus to that procedure.
Yeah, I mean, it was really a no-brainer for me because I didn't want implants because I didn't want to have to go through the kind of maintenance of that. And I'm an
Sure.
infectious diseases doctor. I hate foreign bodies, so I didn't want I
Oh,
I
I
didn't
love
want
it.
any of that. Um, so, but basically, after my radiation was done, he sat down with me and was like, "Is this still what you want to do? And if it is, that's great. And if it's not, let's talk about what else we can do."
Sure.
We didn't talk about a lot of. I know that there's some muscle flap things that y'all can do. There's combination like a lat thing, a latissimus.
Yeah,
Kind
lettuce.
of, yeah,
Yeah, so that would be an option, if
yeah,
if you wanted implants and maybe you didn't have the option because you didn't have enough abdominal tissue, you can use a latissimus to help
yeah.
with coverage if you're going to have radiation, but usually requires an implant as well.
Yeah. So I wanted the option that had no implant and that, gave me the biggest silver lining out of all of this, which
Right,
was a flat tummy.
right. That's great.
Yeah.
So, was there anything that helps you make this decision, in addition to, I know you said the benefits are, you take the abdominal tissue and you avoid implants, and he really spent a lot of time with you. But maybe did you know anyone who had this procedure before, or did you
Um,
just look at pictures of other patients, or?
so I did look at some pictures. I knew two other people who had had breast reconstruction after cancer, and actually I knew three people who had breast cancer and had to have surgery. One of them had no reconstruction. And that really wasn't something I was interested in. Just
Sure.
personally, it's just not in keeping with my body. I would not feel comfortable like that. And then the other folks I talked to were very, very small framed women who ended up having lat procedures with partial implants.
Sure.
I'm a full figured person. I've always had large breasts, and so I wanted to maintain as much normalcy as I could with
Sure.
what I had looked like before. So that was really the main thing. Talking to the other folks about their surgeries didn't really have that much of an impact just because I didn't feel like they looked like me.
Sure. Yeah, that's a really good point. So actually, when I was at UAB, I did a rotation with Dr. Fix, and it's funny because I remember specifically a patient experience where they looked at me and they're like, "You're the woman. What do you want?" And he said, "She's in a very different place in life from you, and
Right.
and it's so dependent upon the patient and, what your goals are and, what age you are
Right.
and like you said, your body habit is what your goals are for, what you want to look like and what you're trying to reconstruct. So it's so different for everyone, and there's so many
Yeah.
factors that you have to take into consideration.
Yeah. Another thing I asked about, and I ended up, I think I would have chosen what I chose regardless. But I have a 4-year-old, and we talked a lot about fertility before my chemo started, and I didn't freeze any of my eggs or anything like that. It was just too much at that time. It was so quick. I didn't want to spend that money and go through all of that, when I could just live my life for a few months before I started chemo.
Right.
Um, and they ended up giving me Lupron throughout my chemo, and I've maintained my fertility through all of it.
Wow, that's great.
Um, so at the end of everything, I was like, I still have the option to have kids, which I didn't expect to have. So that was something I thought about with these surgeries. Like, is something that involves my abdomen going to be something that's not going to allow me to get pregnant again? And you can do it. It's just a little more difficult, is my understanding. Who
Right.
knows if that's in the cards, because this 4-year-old is insane. But if it is, it's possible. So
Yeah, so exactly. So that is the thing with the deep flap. So you're just going to have a scar, you're going to have less laxity to that skin. So when you get
right,
pregnant, it's going to have to stretch out again. And then, just like with any pregnancy, you're going to go from, maybe like a tighter skin to, more lax skin afterwards.
right.
Uh, so,
But I guess because it's such a superficial, the flap is taken from a more superficial part
yeah,
of your abdomen. So it's not like you're compromising your core muscles or anything like that. So I felt comfortable with this surgery regardless of what my future fertility plans were.
right.
And
And
Dr. Fix did a great job explaining all of that.
oh, that's great.
Mhm.
So which doctor took you through, discussing the fertility? Was that your medical oncologist?
Yeah, so I went to see my medical oncologist, and one thing I really liked about him is I walked in the door, and I'd never met him before, and he actually trained with a lot of the people I work with at UAB, and so I guess I had talked to them and um, told them kind of where, my program director, for example, was in his residency class. They were like, "You're gonna love Dr. Jones. He's amazing." And I walked in the room, and he was like, "Don't worry, I'm already texting the reproductive endocrinology folks at UAB for you. I've got you an appointment for tomorrow. I know that's something you're going to want to at least talk about." And it was like the first thing on my mind. He just knew. So my medical oncologist put me in touch with them. And like I said, I saw them very soon after. And you
Wow.
have to make a really quick decision. I mean, it's very tough, when we go through our medical training, you think, I'll get through this hurdle, and then I'll have a kid.
Right.
Um, and if I had done that, I don't know if I would have been able to have a kid. And so you go through all this like psychological
Wow.
craziness, while you're dealing with this cancer diagnosis. And so basically, I was sitting in the reproductive endocrinologist's office, and I was just bawling because she showed me this picture of my beautiful ovaries that had these just so many eggs. And I was like, they're all gonna go away.
Oh my god.
But I couldn't like bear the thought of like spending the 3 weeks between when I was diagnosed and when I started chemo, going to a doctor every day, getting all the drugs that you have to get for fertility,
Right.
when there are some options that can preserve, less, they're much less tried and true. Lupron can kind of put your ovaries to sleep and maybe preserve your fertility. And I was like, considering all these things and my like kind of ambivalence about having another child, I think I'm just gonna go with that. And plus I was still a fellow, so we didn't have any money. So it's not like I can pay $30,000 to bank my eggs.
Oh my
Um,
gosh.
yeah, girl, it was outrageous. And so I was like, it 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 felt, that was one of the most overwhelming things about being diagnosed, was the thought of losing my fertility.
Right.
But when it came down to it, I realized that it just wasn't. I mean, it is what it is, you know. A lot of this journey has been, well, this is just how it's supposed to be, and it's all turned out okay. So
Wow. That is such an incredible story. Oh my god.
yeah, yeah, it was crazy. It was really hard. I talked to a lot of friends who'd been through IVF,
Yeah.
just to kind of get an idea of how intense it was.
Yeah.
Because the other thing about fertility is that you have to pay to bank your eggs, you have to pay to store your eggs, you have to pay to do IVF.
Oh,
So one thing that we talked about, me and my husband, was if we get through all this and we decide we want to have another kid, what if we pay all this money and it doesn't even work out, you know, with
is
IVF? And so we came to terms with the fact that we would either not have another kid or we would adopt a child or find another way, you know?
right.
And it would be, you know, we would be more financially established and it wouldn't be as
Right.
emotional of a decision like making it right in that moment. So,
Yeah, I can't imagine having to decide that in just
yeah,
a few weeks.
it was really hard. And you know, my parents were like, "We'll pay for it." I was like, "You can't."
Yeah. Exactly. I was thinking like in my head, like, oh, someone let's like do a fundraiser, let's get that money. But then that's a lot of money. How do
It's a
we
lot of money and it it all worked out, you know? I mean, it doesn't always work out the way you want it to work out, but like for me, you know, I have the option now, which is good. If
right.
I didn't, it would still be fine.
Wow. That is so incredible. I can't imagine being in your shoes with that.
Yeah, it
Um,
was intense. I was really lucky though that I had you know, I moved back to town for my fellowship. My parents live here. My sister she lives in Mississippi in Starkville, so she lives 2 hours away. And my
mhm.
husband's parents actually moved here the week I was diagnosed. Like they had already planned on moving here and they moved here the week I was
My
diagnosed.
gosh.
Yeah. Like I remember the weekend I was recovering from my breast biopsy, we went swimming in their pool at their apartment and my mother-in-law was like, "What's this bruise you have?" And I was like, "Oh, I got a breast biopsy. It's probably nothing."
Oh, God.
So they ended up here and it all worked out. So we've been lucky to have
Wow.
good support through all of it.
Wow. So talking a little bit about your surgery. So was there anything that surprised you about the surgery or how did it go?
Yeah. So the first surgery was the mastectomy and the expanders, which was much worse than the second surgery, which was not what I
Oh, really?
expected. Yeah. It
I
wasn't what
mean,
I expected.
pain standpoint? Like
Mhm.
painful? Okay.
Pain and swelling. So I had a lot of neuropathic pain in my side where they took all my lymph nodes. And it just felt so strange having this edema in your chest,
Mhm.
along with just numbness throughout your chest and along the back of your arm that was not only numb, but also just very painful. That, along with the swelling and the expanders, are just really uncomfortable. Um,
Right. Yeah.
I just had a really hard time with all of those things. And the rest of it wasn't too bad. You know, I got up and was moving pretty quick. I didn't have a lot of issues with that. And the drains were no fun. I only had 2 drains, so that wasn't too bad. But the pain and the like swelling and the neuropathy was really difficult to manage in the first surgery. Now the second surgery, I had 6
Mhm.
drains, and that was really hard. It was really, really hard to like
Yeah.
carry them around and like know what to do with them.
Maneuver.
Yeah, it was crazy.
Oh my god.
But my pain was not nearly as bad.
That's great.
My pain wasn't nearly as bad. Um, I did have a few complications after the second surgery. I had a seroma at the beginning
Okay.
because one of my drains came out. Like my dog like sat on it while I was
Oh,
sitting on the couch, and it
yeah.
pulled out too soon.
Yeah.
And so I had a seroma, and they drained it off in clinic a couple of times, but it kind of congealed, I guess, and they had to take
Okay.
me to the OR for a washout. So I had to
Okay.
go back to the OR and get a drain placed again. So I actually just got my last drain out like last week.
Oh my gosh.
Yeah, and I had my first surgery in July. But other than
Yeah.
that, the thing
Yeah.
that kind of surprised me with the abdominal part of the surgery was how much, I mean, I know there's a lot of tension there, but it just feels like you're wearing a corset all the time. And the skin at the incision site and the abdomen, it just, there were little openings, and like sometimes they would leak fluid and bleed and things, and I was like, oh my god, it's gonna get infected, I'm gonna dehiss. I had all these like ID doctor like fears of what was happening, and I would call the clinic and they'd be like, you're fine, it's fine. So
Yeah. That's what I was thinking. Just small opening, let it drain.
yeah,
It's good.
it was a big learning experience for me, because we see surgical patients when things go wrong, right? Like when they
Right.
call ID, when I see surgical patients as an ID doctor, it's scary.
Right.
But like most patients don't really have problems that are huge and big and scary, and they can be managed by like minimal, kind of things that you can do in clinic or wound care. It was very educational for me.
It's funny you say that because, for those listening, even as, a doctor, you're saying like, because you don't see the surgery side, it was just
Right.
still a learning experience for you and
Oh, yeah.
things that were maybe a little different than your expectations. So, um, yeah, I can imagine, someone who has no medical background and has no idea. I can imagine it would be really anxiety provoking.
Yeah,
Um,
it was scary. After you have the deep flap surgery, one thing that they didn't really tell me was going to happen was they came and they Dopplered my grafts every hour,
yeah.
which I didn't know they were going to do. And I was like on all the pain meds, and I was having itching from my antibiotics, and they were waking me up every hour. And then I kind of figured out what was going on, because I work in a hospital. But if I were just a patient, I would be so confused and scared. And I was even scared me, because I was like, oh my God, what happens if this graft fails? Um,
So
it's
that's
a
a good
scary thing when you're getting that much attention in the hospital.
right. So that's a good point that, maybe we need to do a better job about expectations of exactly what's going to happen.
Yeah,
Uh,
yeah.
it's
Because
really
there's so many things that we all do as doctors in our respective fields that are second nature to us. And
right.
it's not anybody's fault to not explain all of those things, but it really opened my eyes to like, am I telling my patients everything they need to know about what's going to happen when they take this medicine or they get this PIC line for their antibiotics or whatever?
Right. Yeah, I don't think I've ever thought to tell a patient in clinic, we're going to wake you up every hour and
Yeah.
listen to this flap.
Yeah.
Um,
And like
yeah.
I had one of those little tubes one of those like feeding tube extenders that I used to keep all my drains together. And I
Okay.
put them around my neck so that I wouldn't lose them. And Dr. Fix came in and he was like, oh my God, don't put that on your chest. You're going to like disrupt the anastomosis,
Yeah.
things that I don't think of. So,
Right. Yeah. I mean,
yeah.
one thing that I've thought of is, through means like this or maybe through social media, I'm going to try to, do videos to try to educate patients on things because there's so many things that we need to tell you and there's just not enough time to say all of them.
Exactly. It's incredible. I mean, it really is.
All right. So, tell me about when you had your diagnosis in the beginning. You were just starting your fellowship, is that right? Or you were in the middle of your fellowship? So, what
Yeah.
was it like navigating your career, your fellowship, and being a working mom and all
It
the
was
above?
crazy. It was crazy. So I was like, it was June of 2019. So it was like right in between my first and second year. And,
Mm.
again, everything happens the way it's supposed to happen. I'm not a religious person, but I definitely have more of a sense of like things happen the way they're supposed to happen after all of this.
Right.
So I had, like I said earlier, kind of gotten more into research during my first year of fellowship than I ever was in residency. and
Mhm.
I'd applied for this T32 training grant to do health outcomes research. And I think it was the day that I got diagnosed, I found out that I got into that training grant. And what that training grant does is protects your time for you to do research 90% of your time. And
Wow.
so the first year of ID fellowship is like very clinically heavy. So I had already done pretty much all of my clinical requirements. And so my second year was funded by this grant for me to do research all the time. And so I told my mentor, who I have a fantastic relationship with, and I told my T32 what was going on, and they were like, and my program director, and they all said, whatever you need, you can make your own schedule, you know, be as productive as you need to be to like stay sane because that's who you are. Like you're someone who works through hard things, but tell us if it's too much. So
Sure.
it was kind of a built-in flexible schedule because I was on this research year. And I also have the most wonderful division supporting me. So I basically saw my HIV clinic patients once a week. I didn't see anybody who was immunosuppressed when I was on chemo because I couldn't. And
Right.
then I didn't have to be in the hospital from when I was diagnosed. I didn't work in the hospital until May. So I
Wow.
had like 9 months where I didn't have to go see, tuberculosis patients while I was on
Oh,
chemo. So that was good. But
yeah.
of course, what was happening in May was COVID. So I did have to do a little bit of COVID work, but I was I was past chemo then, so I was doing better.
Oh,
So yeah, I kind of was very fortunate in that I had a lot of protected time, and my mentor and I have a very open relationship as far as how we communicate. And I told her, I said, give me every opportunity you would give me if I wasn't going through this, and be okay when I say no. Like, be okay with it when I tell you I can't. And that worked really well for us. I think I got 2 grants like 2 different research
oh my
grants while I was on chemo, and I published like 4 papers.
oh my god.
Yeah, it was,
That's
I mean,
more than I've done in years without any of what
I
you're doing.
wrote a grant while I was getting chemo, like I was writing it in the chemo chair and it got funded.
Oh
So
gosh.
I worked through it, and I think that helped me deal with it, honestly. I had a lot of balance and I had a lot of help. Like, my husband is incredible. My division brought me dinner 3 nights a week throughout
Wow.
all my chemo and all my surgery recoveries. Like, Mike Sag came to my house and brought me dinner
Oh,
multiple times. Like,
wow.
Mike Sag is like a world renowned infectious diseases doctor, one of the busiest people I know, but they all just care about their fellows and their coworkers. So I mean, I don't get emotional about this, but I get really emotional about like how much support I got,
Right.
from my coworkers because it was truly amazing.
Oh my
That's the
gosh.
only way I got through it, and I graduated on time, and they hired me to stay.
Well, who wouldn't hire you after all after being so productive and everything else? Oh my gosh.
Well, it's weird. We go through this. I don't know. I feel like going through medical training, you feel like you should have to push through everything. And some people cope that way. That's how I cope. But
Mhm.
I also learned that a lot of these people that you work with and for will definitely be okay with you saying you're not okay. As long as you speak up and tell them, I need this time. And they respect you for it. And, I've garnered a stronger relationship with my division director, my mentor, everybody that I work with. I feel more connected to them. And I feel like they respect me for what I've done and what I've gone through, but also like I've had to negotiate, my time really, really well. Like I've had to do a lot of hard organizing and things that other people haven't had to do.
Right.
Not just being productive, but like prioritizing.
Right.
So it was a very humbling and wonderful experience, like in that regard.
Sure.
Hmm.
I can't imagine doing all of that.
It was
I
crazy.
I'm
It feels
really
weird
proud of
being,
you and everything
thank
that you've done.
you. It
That's
feels really weird being on the other side of it now.
right.
So
Which I heard, so you have good news?
Yeah, so I had my first surveillance scan on Monday and it was negative.
Yay! That's
So, yeah, my
Congratulations.
oncologist was like, "You're out of the danger zone."
gosh, that is amazing.
Yeah, so I'm very with her too, the highest risk of recurrence is in the first year. So I'm pretty much out of that, which is wonderful.
That's amazing.
Mhm.
So, this is just an incredible story, and you shared so much. If there's anything else you want to tell us, or do you have a final thought for women out there that maybe they've just got their diagnosis, maybe they're young, maybe they're worried about this in the future? Is there anything that you would want to tell them?
I think it's a really horrible thing to happen at any time in your life, but I think you can always find good things in it, and you may find that you are now able to put value in the things that you may have overlooked before, especially if you're a busy career person. You value that time with your kids more, you value that time with your family more. You're more willing to, all those negotiating skills I was talking about with your job, you can translate that into your real life and find balance after going through something like this because you realize what's really important. Um, so that's the deep final thought. The superficial final thought is the thing I was most scared about. I said it was my fertility earlier, is actually losing my hair. I was like horrified of losing my hair. I was so upset because I had long blonde hair. Morgan knows I had like long blonde hair. Um, I, I and I was just like, what am I gonna do when I'm bald? And when my hair started falling out, I was a wreck. Like the whole weekend, I just like laid in bed and cried because I was so upset. And then I shaved my head. My husband helped me, and I was like,
Oh,
I look
gosh.
fierce. I love this. Um, so your
Yeah.
hair will grow back, but it also probably will look really fierce when you're bald. So don't worry about that.
I saw your pictures and you just really rocked it. And
Yeah,
the whole
I
time
mean,
I was thinking, like, I wish I had that confidence.
get some good earrings, get some good lipstick. I bought some wigs, but I never really wore them because I liked accessorizing with the head wraps. So you'll find
Yeah.
things about yourself that surprise you, like as far as, things that you like about yourself. So
Well, thank you so much. This was a really great interview, and I'm so glad we got to talk to you. And I'm glad that we were able to hopefully, you know, um, inspire some other women out there who may be going through this and maybe having a tough time with their diagnosis.
yeah, happy October.
Yes, happy October. Happy Breast Cancer Awareness Month. Bye, everyone, and we'll
Bye.
see you next time.
Bye.
Bye.
Thank you for supporting this podcast. If you have questions or advice, feel free to reach out to us via social media. Follow us for more educational content, including the recorded episodes with visual supplements. You can find these on Instagram at The Loupe Podcast, or our YouTube channel, The Loupe Podcast, or our website, theloopepodcast.buzzsprout.com. Thank you for your support, and we will see you next time.